Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale, Paradise Valley area for over 22 years, since 1992. All I perform is cosmetic or aesthetic plastic surgery, and one of my favorite and most common procedures is facial rejuvenation, whether it entails a brow lift, whether it entails upper eyelid surgery, or a facelift, which involves everything below the eyes, including the neck. One of the telltale signs of a facelift is hairline shift. So people that see hair loss along the sideburns, all of a sudden they've lost their sideburn. If you see hairline shifts or step-offs behind the behind the ear at the hairline in the back of the scalp, and along the anterior hairline, if you see a real shift of the brow, we really don't want to enlarge the brow, we want to actually lower it if we can. I think that really should be an indication of a facelift that's from the past. When I perform a facelift, I'm very cognizant and aware of what we're trying to achieve, and that is really no telltale signs of surgery. Most commonly, I will do a brow lift that does not elevate the forehead, that really does not shift the scalp, and really becomes quite invisible to other people. The sideburn is a very important part of a facelift in terms of not having any shift of the sideburn and really not losing any hair there. So most commonly I will have the incision follow along the sideburn, so you really don't see that shift that happens quite frequently with other surgeons. And I think it's because of either lack of premeditation on their part or really lack of sensitivity on the surgeon's part that this is an important part of a person's identity, and we want to try to avoid that hairline shift. Behind the ear, I think it's very important not to see any step-off of any hairline here and have that incision fall very inconspicuously along the hairline and then go back into the hair. So the answer to the question when people tell me or ask me that they want to avoid and will there be any hairline shift, the answer should be very minimal to none at all. It's very important for me to have the facelift be your prerogative about being able to tell people that you've had it done. If you don't want to tell, they shouldn't be able to tell anything's been done. So I think those incisions should be hidden and nearly invisible. And I think the proof is that so many of my consultations come in from hairdressers that are so impressed with the incisions and the lack of the ability to tell that anything's been done. So if there's any questions that come in for consultation, thank you.